come work a 12-hour day shift with a labor and delivery nurse. So my shifts start bright and early at 7:30 a.m. Every day as a labor and delivery nurse looks a little bit different, but today I was scheduled to be in the operating room. So I made sure to have something to eat really quickly, and then I put on my scrub cap. I was the circulating nurse for this C-section, which means that I was responsible for knowing all of the important information about the patient, and I remained not sterile. After the C-section was done, I took the patient to recovery and we did her vital signs every 15 minutes, checked on her bleeding, and did a lot of skin-to-skin and breastfeeding. It's also my job to take the baby's vital signs at 1 hour of life to make sure that they are transitioning well into the real world. After finishing up my charting and transferring my patient to postpartum, I was able to have a break to have my overnight oats, which were so yummy, and then it was back into the operating room for C-section number 2. So we had 2 scheduled C-sections this day. And instead of circulating this time, I was the scrub nurse. So I made sure to throw around the OR with all clean equipment and sterilized instruments. And then I made sure the rest of the operating room was set up for the spinal anesthetic, the cord blood gases, and then all of the emergency equipment was ready to go, like the suction canisters. I also laid out the surgeon's specific sutures and glove size that they wear, as well as my gloves before I got ready to scrub. Before scrubbing, I always make sure to tie my pants up really tight because they love to fall down when I can't grab them. And then I put on a mask with a face shield in case there's any blood splatter, and I made sure to take off my watch, any rings, anything. I have to be bare from below the elbows down when I scrub. After finishing up with that C-section and bringing that patient to the recovery room, I actually set up the room for another patient who was coming in active labor. She called ahead of time, so I knew she was coming in, so I made sure to set up my room just the way I like it and made sure we had all the supplies ready to go. Once she arrived, I quickly admitted her and then gave her one of these birthing balls to help her cope with some of the contraction pain, and then she quickly decided that she wanted the epidural, which was completely fine with me, so I made sure to call the anesthesiologist and get her comfortable with her epidural. This bundle birth position guide is my holy grail. I absolutely love it, and I swear by all these different positions, especially the ones with the peanut ball. This was my patient's second baby, so before I knew it, she was fully dilated and ready to push, and we had a beautiful baby girl. I finished her postpartum recovery and then transferred her to her new postpartum room at about 1 hour after her delivery, and then I was able to catch up on a lot of my charting that I had to do from the delivery. I also took a couple triage calls before it was shift change, and Daniel, my fiance, came to pick me up, which was so nice. I hate driving after a 12-hour shift.